Hi everybody, so we're going to begin the webinar now. My name is Courtney Kesterson. I'm the Disaster Preparedness Program Coordinator. And with us we have Deanne Walters, who's the Director of Clinical Affairs here at CAHF. And this is the first webinar for the Los Angeles County SNF Mutual Aid Program. Deanne, you want to say hi?
Hello everybody and welcome this afternoon to our call.
Okay, so we already introduced ourselves, and then we also are going to be hearing today from our consultant, Rich Widerynski, who's down in LA County. And he's going to be giving us an update on the DRCs down there, as well as, Norma Lopez from ReddiNet, who is the customer relations manager there, and she will be giving some input on some slides we have about how to actually navigate around ReddiNet. And we also have Chris Sandoval here with us today, who is from LA County Department of Health Services. So let's see, does everybody want to say hi just to go ahead and check the audio?
Hi, this is Norma Lopez.
And Rich, do you hear us there?
I can hear you, but we're working off of Karen's phone, which is fine.
All right. Way to MacGyver it there. You are truly our consultant for emergency preparedness.
I didn't have my wife, trust me. Thank you.
All right. So next, just going through our slides here. So since this is our first webinar, this is just some bullet points about what we're trying to accomplish. Trying to give a platform for SNFs to share information and put it on YouTube and get that out there. And having Chris Sandoval from the Department of Health Services today is important because a part of the new CMS emergency preparedness regulations is working with your county to prepare for disasters. So this is a two-way flow of information, and we're all working together here today to make sure that skilled nursing has what they need to respond to disasters in LA County. So if you're new to emergency preparedness, these are some terms that we're going to be talking about a lot, and I've tried to type everything out in plain language, but sometimes you might see these, and so these are some phrases that you'll see a lot. And then down at the bottom we have our own disaster preparedness program. We are underneath the California Association of Health Facilities. We have a grant with the State of California Department of Public Health and also LA County EMS, and we provide trainings around the state on emergency preparedness. So the reason why you're probably looking for this information or this video on YouTube or came to our webinar today is because of this CMS emergency preparedness rule. So at the top there we have a quote directly from the rule itself, and it's kind of showing how CMS put out these regulations because we have a lot of work to do, beginning with this kind of raised awareness after Hurricane Katrina, and then even today this is September 21st, and Hurricane Maria has knocked out power to the entire island of Puerto Rico. So this is not only a regulatory guide for you, but also just a best practice overall. The way that CMS wants you to prepare for this is by basically overhauling your emergency preparedness program if you had one before. And then also probably the most tangible evidence of this is going to be these exercises that you have to do twice a year. One of them needs to be a full-scale exercise, and then the other one can be a tabletop exercise. And if you're looking for more information on that, you can check out some of our other videos from CAHF DPP or go to our website, cahfdisasterprep.com. All right, so moving right along, this is kind of what we're looking at when we're trying to tackle building a mutual aid program for LA County. There's hundreds of skilled nursing facilities in LA County, all the way from Long Beach to Palmdale. So we've tried a few different approaches, and I think that moving forward, getting these DRC updates from Rich Widerynski, who travels around to the different disaster resource centers, which is how LA County builds these healthcare coalitions that we're going to learn and talk more about as time goes on. Let's see here. Okay, so the DRCs, there's 10 in LA County, and these are kind of like the regional centers that you can network with in order to have better access to disaster resources or communications or transportation. And they meet usually bi-monthly, and so Rich travels around to some of these big, beautiful hospitals and all over LA County. This is an example here. And this is kind of how the flow of our program goes down in LA County. As you can see, we work with EMS, which would be Chris Sandoval, who would be the SNF contact in that department. And then we push information and get information from Rich Widerynski as a consultant for us, who is our boots on the ground down there in LA County. And actually, oops. Rich, do you want to kind of jump into what you've been finding out from some of these meetings here in the DRCs? I think we could just go straight into the update, right, Dan?
Sounds like a good plan. Rich?
Okay, can you hear me?
Yep, loud and clear.
Okay, so I've attended several of the CAHF DRCs, and one of the things that I've realized across the board is the need for additional communication between the DRCs, between our SNFs. And it's, we've got like 400 nursing facilities in LA County, so I know that it's difficult, but nonetheless, improved communication is very, very important. Also, one of the things that people have continuously brought up is that all of the phone numbers and email addresses of emergency responders in our facilities be up to date and that are available for our staff to know who the important players are. We also, an issue that was brought up last week at the Department of Public Health here in Long Beach was to have pertinent transfer agreements between facilities. So, for instance, if you're at a facility and something egregious happens, you could go to another facility. And as we've learned from the tragedy in Florida, where those 9 people died in a nursing home, they literally had a trauma center across the street that had air conditioning. And so, why this wasn't communicated, why people didn't do something is beyond everyone. I know that. In a facility in Houston or in Texas, volunteers evacuated the residents from a nursing home that was 3 foot in water. And they then, apparently, these people were taken to places that the nursing facility did not know where they were at. So if you have volunteers or utilize this wonderful resource, it's a matter of training them better. Another point that has been illustrated several times is make sure that the desktop or that the disaster training is uncomplicated. So, for instance, if you want your staff to come, provide something to eat. On the 11 to 7 shift, you can easily make sure that people know where the flashlights are located, or make sure that you have flashlights, make sure that you have batteries, and make sure, again, that you can kind of communicate with the people on the outside, even though it's the 11 to 7 shift, the knock shift, when, there's not that much happening, but, an earthquake might happen in the middle of the night. And then last but not least, one of the things that was discussed recently at one of the meetings was that more in-house walkie-talkies are purchased, training is done on them, and then the tools are disseminated to staff to be able to be utilized throughout the building in the event of a disaster, or for that matter, just use walkie-talkies within the facility so that your overhead paging isn't very loud and disruptive to the patients or their families. And that's about it.
Great, Rich. Thank you. That was perfect. That was short and sweet, and that covered a lot of ground. That was great. I just want to clap right now. Okay, moving on then. So the next step for our mutual aid program here, this is just laying it out really quickly what we have planned for the next quarter. So you can see today's date at the top. And then I've had a lot of people ask about the Great California Shakeout exercise. So if you're interested, you should check out their website because they do have stuff on there for healthcare facilities. But most importantly, if you want to know, this is the reason why we're here today, if you want to know what LA County wants you to do, they have their own program. They have a lot of stuff already done for you. All these forms that you need, they have on there, and they want you to fill them out a certain way and turn them back in. So we're going to learn more about how to do that. And
Courtney,
yes.
Excuse me, if I could interrupt. So one of the things we were talking about earlier was that if you want to use the California the shakeout as a exercise, if you link it to your police, to your fire marshal, to the fire department, then you can take credit for that in terms of that being an exercise with another entity within the county.
Yes, yeah. For the full-scale exercise, which is going to be the most difficult part of the CMS EP rule, it's going to be those interagency, community-based full-scale exercises. So if you take something like the Great Shakeout, you want to involve another agency or work with another facility to do some kind of patient transfer simulation so that both of you can practice together and share that. Okay, but in LA County, there is something that you do need to be doing to meet these regulations for CMS, and that is getting on ReddiNet. In the emergency preparedness rule, you need to be working with whatever the county is using for emergency notifications. So for LA County, that means getting on ReddiNet here. And today we have Norma Lopez with us. She is our connection at ReddiNet. And Norma, do you want to say hi to everybody right now?
Sure, just want to say hi to everybody and also acknowledge CAHF for doing such a great job on getting these past 2 months. We've seen so many SNFs and LTCs sign up, and that's great. It's very simple. You get your contact form, fill that out, send it back into us, and we schedule a 1-hour webinar with you, and you get your usernames and passwords, so it's very easy.
Awesome. Yep. You can send it to me or send it to Norma. We're just CCing each other on that so that we can keep track of everybody. And so this is a little blurb I pulled off of their website, and that's their website there. And so LA County, they want to be able to use ReddiNet for SNFs so that they can get bed polling information. And then you can also submit resource requests through ReddiNet back to the county. And Norma, if you want to jump in at any point on these upcoming slides, just feel free. It's just a large conference call really, but just for the entire county.
Okay, sure.
Yeah. Okay. So ReddiNet, I think we already talked about. It's a communications tool. It's web and satellite based, so if one system goes down, it's still active on the other. And so ReddiNet is how all of these different agencies listed their talk to each other or receive information from the county. And so when there's an area-wide disaster in LA County, they will stand up what's known as a medical alert center. And so this is kind of just a rundown of why the MAC or the Medical Alert Center uses ReddiNet, how it moves information around in the larger response effort and ties it all together. And so you can see with the ability to get open bed information from skilled nursing facilities. Hospitals during a disaster can be able to move patients, or SNFs can talk to the county, who can relay transportation resources to move residents if that's needed. And so, Norma, do you want to kind of give us a short explanation on how to navigate around ReddiNet, or would you like to kind of go back and forth?
We can go back and forth, but I do want to mention the SNFs and LTCs in LA have a certain number of modules. So when we do the training, we focus on assessment module, messages, and bed capacity. So the status screen, not LTCs don't necessarily see it, but it gives hospitals an overview of what's happening in the emergency departments.
Right, and these screenshots here are from LA County's participation seminar that happened on September 12th. So some of this information, it might say hospital in it, but it's still like the same way of how you navigate around ReddiNet. And so this is kind of the legend for the different color codes. This might say, it might have some different text for you if you're a skilled nursing facility, but these, obviously, if there is, when you are using this on a daily basis, you'll need to check in on ReddiNet, and it'll put your name in green, and the LA County EMS will be able to get an overview of which facilities are functional, who might need assistance, who might not be able to accept new patients or residents. Norma, do you have anything else you want to add before I move on?
No, that's good.
Okay. And so this is some of the information, like if you click on the name, you'll be able to see kind of like a quick rundown of what the facility has to offer or who their contact information is. And so how LA County is planning to use this during the statewide medical health exercise is it'll match the scenario that they've written, which is a mass casualty incident. If you want to learn more about exactly what that is, you can go to the LA County EMS website, and the link for that, it will be at the end of the PowerPoint, and I'm also going to post it on the YouTube page. But that will be the event that they've chosen. And so how SNFs can participate in that is by receiving these bed polls and giving back information as if a hospital needed to decompress or give them more patients to the skilled nursing facility. Another thing that you can receive through ReddiNet to participate in the statewide are these assessment polls. And then they take that information and they roll it up into a broader poll called HAVBED, and that goes to the hospitals. And then the county is taking all that information and allotting resources as the scenario unfolds. So you might get multiple notifications through ReddiNet as the exercise goes on. And then if you want to respond through ReddiNet, you can submit a resource request. And we're actually going to have another webinar on resource requests after this one, because it's really specific how LA County wants you to fill it out. And you have to get like 2 people to sign it. It's a whole thing. So back into the screenshots. So when there's the drill or the exercise going on, you'll see this red bar at the top, and that will let you know that it's there's an activation of the emergency system going on. And this is what it'll look like when it pops up on your screen. And you'll have only a few minutes to really answer and put in the information, and then send it back to LA County so that they can get that real-time information that the system is built for. And Norma, do you have anything you want to add on to that before I move on?
Yeah, the first screen that you showed, the one before that, that's what the SNFs are going to receive. That's what we call the general notification. So that just gives them a heads up of what's happening in the county. It gives them a brief summary of the MCI. The second one that you showed, that goes to the hospitals and that requests their ED capacity, how many immediate, how many delayed, and how many minor they can accept. So just so they, so you know the difference, the SNFs will get just the general notification, and then hospitals receive this ED capacity poll.
Okay. So this is some notes on what an assessment poll is. When the LA County is trying to allot resources, sometimes they may need to know what you need, or also if your facility's been damaged, if your capacity for caring for your residents has been diminished. Let's see. They say that you should respond within 30 minutes, but they're really looking for like 1 to 2 minutes. Like, this should be a dedicated role in your emergency response. This is what the assessment poll would look like. And as you can see, well, they might send out different assessment polls depending on what they're trying to gauge. So these are some screenshots of some different ones. And as you can see, that bottom right one, they're asking about what kind of damage has been done to your building after an earthquake, for example. And here we have kind of a brief overview of a resource request. This is going to be our next webinar on how to fill this out properly, because you have to be, one, very specific, and have it checked by a second person and signed, and then even write down to what kind of nurse you need. If you need a pediatric nurse, or I don't even know how many different nurses there are, but you have to be right down to the letter, otherwise they will send it back to you. So that's going to be our next one. And let's see. I'm just going to check the questions, see if we got any from our viewers here. Sorry, 1 second. I'm just going to make this a little bigger. So Mike Hurtado, how would you reach out to those agencies? Would the Disaster Resource Center help? Yes, so the Disaster Resource Center is kind of looking like your local healthcare coalition. So you definitely want to network with your Disaster Resource Center, because you want to have a relationship with the person who is closest to you, because in a large earthquake, the transportation systems, the county might not be able to get to you for days. And we saw that in the Northridge earthquake. There were several nursing homes who it was 2 or 3 days before transportation actually reached them. So you want to build those local relationships and think about developing MOUs with nursing homes nearby as well. So thanks, Mike. And with that, I think we have reached the end of our webinar. And so we will see you next time. And if you have any questions, you can reach me. Again, my name is Courtney Kesterson, and this is Deanne Walters here. You can reach us. Our contact information is at www.cahfdisasterprep.com. And we will see you in a couple months. Thank you.
Thank you, Courtney.
Thank you.
Yeah.